Poor circulation, memory loss, even heart disease. All of them share one silent warning sign that appears every single morning, and almost every doctor dismisses it as nothing. If you wake up with a dry mouth, your body is not thirsty. It is sending you a distress signal, and ignoring it could cost you far more than a sip of water. Most people grab a glass of water and move on. That is the mistake, because dry mouth in the morning is not caused by dehydration. It is caused by something happening inside your body overnight while you sleep, something your doctor has almost certainly never explained to you. Stay with me, because the number one cause I am going to reveal today is so closely linked to early heart disease, kidney failure, and cognitive decline that one landmark study found patients who addressed it reduced their cardiovascular risk by up to 43%. And yet, most physicians spend less than 30 seconds discussing it at annual checkups. I am Dr. Michael Carter, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have treated thousands of men and women over 60 who came to me with complaints their previous doctors brushed aside. Dry mouth was almost always one of them, and what I found underneath that symptom again and again was a body quietly falling apart in ways that are 100% correctable. What I am about to share goes against the comfortable, dismissive answer most of you have been given, but I have seen it with my own eyes, patient after patient, and I refuse to stay silent any longer. Before we go further, let me ask you something. How old are you? In your 60s, your 70s, maybe beyond? If you wake up most mornings with a dry, sticky, or pasty feeling in your mouth, type "dry" in the comments right now. I want to see how many of us are experiencing this, because I suspect the number is going to be extraordinary. What is actually happening? After 60, your body undergoes a series of changes that most doctors lump under the umbrella of just getting older. But that phrase is doing a tremendous amount of damage. Because when your doctor says, just getting older, what they are really saying is, I do not think this is worth investigating. And that is where lives go wrong. Saliva is not just moisture. It is a complex biological fluid produced by 3 pairs of major glands in your mouth. It contains enzymes, antimicrobial compounds, proteins, and electrolytes that are essential for digestion, immune defense, and even brain health. When saliva production drops, your body is not simply becoming drier. It is losing a critical protective system. Here's what the research tells us. After the age of 60, saliva production can decline by as much as 40%. The Journal of the American Geriatric Society published findings showing that chronic dry mouth in adults over 65 is associated with a 300% higher rate of oral infections, a significantly elevated risk of systemic inflammation, and measurable cognitive changes over a 5-year period. And here's what terrifies me most. Most of the causes are invisible until they are not, until the damage is already progressing, until the warning signs that were sitting right in front of us every single morning get dismissed with "drink more water and move along." The 7 most common and dangerous causes of waking up with a dry mouth after 67, sleeping with your mouth open. This one sounds simple, even obvious, and it is the least dangerous on our list. But do not let that fool you into dismissing it. Sleeping with your mouth open is almost never a personal habit or a quirk. It is a symptom of something else entirely. When you breathe through your mouth during sleep, the airflow evaporates saliva rapidly, leaving your oral tissues parched by morning. What most people do not understand is why it is happening. After 60, the muscles in the soft palate and throat lose tone. Nasal passages become more prone to congestion, and the result is that your body defaults to mouth breathing as a survival mechanism during sleep. But here is the danger. Mouth breathing during sleep is one of the earliest and most reliable indicators of obstructive sleep apnea. And sleep apnea in adults over 60 is not just a nuisance. A study published in the Journal of the American Medical Association found that untreated sleep apnea in adults over 65 is associated with a 60% increased risk of developing dementia within 10 years. If you are waking up with a dry mouth and feel unrefreshed in the morning, if you have been told you snore, or if you find yourself dozing off after meals, do not accept this as normal aging. Ask your doctor specifically about a sleep study. Practical step. Before bed, try nasal strips to encourage nasal breathing. Keep your bedroom humidified at 40 to 50% humidity. Sleep on your side rather than your back. These are not cures if sleep apnea is present, but they reduce oral dryness significantly while you pursue a proper diagnosis. 6. Dehydration that runs deeper than you think. Yes, dehydration is on this list, but not the simple kind. The kind you fix with a glass of water. This is something far more insidious and far more common in adults over 60. Here is what the research shows. The thirst mechanism, the biological signal that tells your brain you need water, degrades significantly after the age of 60. Studies from the National Institute on Aging found that older adults experience a 30 to 40% reduction in thirst sensation compared to younger adults. What this means is that by the time you feel thirsty, you are already significantly dehydrated. Mild chronic dehydration does something most people are completely unaware of. It reduces blood volume, and when blood volume drops, your salivary glands, which require strong arterial pressure to function optimally, begin producing less saliva. The result shows up every morning when you wake up with that dry, cottony feeling. But there is more. Chronic mild dehydration accelerates kidney decline, impairs cognition, thickens the blood, and raises cardiovascular risk. It has also been directly linked to urinary tract infections, which are the #1 cause of hospitalization in adults over 70. Practical step. Do not wait to feel thirsty. Set a schedule. 8 ounces of water first thing in the morning before coffee, 8 ounces with every meal, 6 to 8 ounces between meals every 2 hours. Total daily target for adults over 60, 60 to 64 ounces. Avoid alcohol and excessive caffeine in the evening, both of which are diuretics that accelerate nighttime dehydration. 5. Medications, the silent saliva thief. This is where things get serious. There are over 500 commonly prescribed medications that list dry mouth as a side effect, and in adults over 60 who are frequently managing multiple conditions simultaneously, the combination of even 2 or 3 of these medications can reduce saliva production dramatically. Which medications are the worst offenders? Antihistamines, prescription and over-the-counter allergy medications, antidepressants, particularly older tricyclics, and many SSRIs, blood pressure, medications, specifically diuretics and beta blockers, bladder control medications, including many overactive bladder drugs, anti-anxiety medications, certain pain medications, proton pump inhibitors used for acid reflux. A study published in Gerodontology found that adults over 65 taking 4 or more medications simultaneously had a 78% incidence of clinically significant dry mouth. Here is the critical mistake most patients make. They assume that if a medication is causing a side effect, they simply have to live with it. That is not true. Often there are alternative medications within the same class that cause significantly less oral dryness. Sometimes the dose can be adjusted. Sometimes the timing of the medication can shift saliva production patterns enough to reduce morning symptoms. Practical step. Write down every medication you take, prescription, over-the-counter, and supplements, and bring that list to your next appointment. Ask your doctor, which of these medications are most likely contributing to dry mouth? Are there alternatives with fewer salivary effects? Do not accept a dismissive answer. If your doctor cannot spend 5 minutes reviewing your medication list for side effects, you deserve a doctor who will. 4. Autoimmune conditions. Hiding in plain sight. This is the point where dry mouth stops being a minor nuisance and becomes a potential signal of something that requires immediate medical attention. There is an autoimmune condition called Sjogren's syndrome, pronounced Sjogren's, that specifically and aggressively targets the moisture-producing glands in the body, the salivary glands, the tear glands. It affects an estimated 4 million Americans, 90% of them women. And here is the devastating part. The average time from onset of symptoms to diagnosis is over 6 years. 6 years of dry mouth, dry eyes, fatigue, and joint pain being dismissed as aging, menopause, or anxiety. Sjogren's syndrome is not just uncomfortable. Undiagnosed and untreated, it significantly increases the risk of dental decay, oral infections, lymphoma, kidney damage, and peripheral neuropathy. But Sjogren's is not the only autoimmune condition that announces itself through morning dry mouth. Lupus, rheumatoid arthritis, and diabetes all affect saliva production significantly. Practical step. If you experience dry mouth, along with any combination of the following, you need specific blood tests, not reassurance. Dry eyes that feel gritty or burning. Joint pain or swelling, especially in the hands. Fatigue that sleep does not resolve. Difficulty swallowing. A chronic sensation of needing to rinse your mouth. Ask your doctor for an ANA panel, S, SA, and SSB, antibody tests, a fasting glucose and HbA1c, full rheumatological evaluation if any tests come back abnormal. This is not being a hypochondriac. This is being an informed patient, and you deserve that. 3. Diabetes and blood sugar dysregulation. If there is one condition I believe is most systematically underdiagnosed in adults over 60, it is prediabetes and early type 2 diabetes. And one of its earliest and most consistent warning signs is chronic morning dry mouth. Here's the mechanism. Elevated blood glucose causes the kidneys to work overtime to filter excess sugar from the bloodstream. This process requires enormous amounts of fluid, pulling water from tissues throughout the body, including the salivary glands. The result is a cycle of cellular dehydration that no amount of drinking water fully corrects, because the root cause is the blood sugar itself. According to the American Diabetes Association, approximately 1 in 3 adults over 65 has diabetes. An estimated 25% of those cases remain undiagnosed. More than 50% of adults over 65 meet the criteria for prediabetes. A study published in the Journal of Clinical Endocrinology found that dry mouth severe enough to interfere with sleep was present in 67% of newly diagnosed type 2 diabetic patients. And that symptom had existed, on average, for 2 years before the diagnosis was made. 2 years of your body warning you, and nobody connecting the dots. Other symptoms to watch for, alongside morning dry mouth: frequent nighttime urination, unexplained weight changes, blurred vision that varies throughout the day, tingling or numbness in the feet, cuts or bruises that heal slowly, fatigue after meals. Practical step. If you have not had a full fasting glucose panel and HbA1c test within the last year, get one this month. Not because you should panic, but because you should know. Catching blood sugar dysregulation at the prediabetes stage is one of the most powerful interventions in all of senior medicine. Catching it there with dietary changes and specific lifestyle adjustments can prevent you from ever developing full type 2 diabetes. 2. Kidney function decline. We are getting into territory now that most people are completely unaware of, and it is critical. The kidneys are responsible for maintaining fluid and electrolyte balance throughout the body. When kidney function begins to decline, a condition known as chronic kidney disease, CKD, the body loses its ability to regulate hydration effectively at the cellular level. Waste products that healthy kidneys would filter out begin to accumulate in the bloodstream. And one of the earliest and most overlooked symptoms is a persistent dry, metallic, or unpleasant taste in the mouth upon waking. Here is the alarming part. According to the National Kidney Foundation, approximately 37% of adults over 65 have some degree of chronic kidney disease, and in more than 50% of those cases, the condition is not diagnosed until it has already progressed to stage 3 or beyond. Chronic kidney disease at stage 3 or higher is associated with dramatically elevated cardiovascular risk, a 5 to 7 times higher incidence of hospitalization, significant acceleration of cognitive decline. The kidneys do not hurt when they are struggling. They do not announce their distress loudly, they whisper. And one of those whispers is the persistent dry, sometimes metallic mouth you wake up with every morning. Other signs that accompany kidney-related dry mouth: puffiness around the eyes in the morning, swelling in the ankles or feet by evening, changes in urination frequency or color, fatigue disproportionate to your activity level, skin that feels chronically itchy without a dermatological explanation. Practical step: a simple blood test called a comprehensive metabolic panel includes creatinine and eGFR values that directly measure kidney filtration function. If you have not had this checked in the last year, request it at your next appointment. If your eGFR comes back below 60, you need to be referred to a nephrologist, not eventually, now. This is one of those situations where early intervention is the entire game. Kidney disease caught at stage 2 or early stage 3 with proper management can be stabilized and, in some cases, partially reversed. Caught at stage 4 or 5, the options narrow dramatically. 1. Chronic low-grade systemic inflammation and autonomic nervous system dysregulation. I know that sounds complex. Let me make it clear. After 60, the body undergoes a slow, insidious process that researchers now call inflammaging, a combination of inflammation and aging. It represents a state of chronic low-level systemic inflammation that simmers in the body for years, even decades, without producing dramatic symptoms. No fever, no acute pain, just a gradual degradation of function across virtually every organ system. And the salivary glands are exquisitely sensitive to it. Here's the mechanism. Inflammatory cytokines, chemical messengers produced during chronic inflammation, directly suppress the function of the salivary glands and disrupt the autonomic nervous system signals that regulate saliva production during sleep. The parasympathetic nervous system, the branch that governs rest, digestion, and saliva production, becomes chronically suppressed. The result? During the nighttime hours, when your body should be producing steady background levels of saliva to maintain oral health, the signal is being blocked. You wake up parched, not because your glands are broken, but because the communication system between your brain and your glands is being disrupted by inflammation. A landmark study published in Frontiers in Aging found that adults with elevated inflammatory markers, specifically CRP and interleukin-6, were 4 times more likely to report chronic morning dry mouth than adults with normal inflammatory profiles. And here is what makes this the most important item on this list. Chronic systemic inflammation is not just causing your dry mouth, it is simultaneously increasing your risk for heart disease, Alzheimer's disease type 2, diabetes, certain cancers, autoimmune conditions. It is the common thread running through almost every major chronic disease of aging. The good news? Inflammaging is driven by 4 primary factors, all of which are modifiable. Gut microbiome imbalance disrupts the immune system's ability to regulate inflammation. Poor sleep quality fails to clear inflammatory waste from the brain and body. Sedentary behavior removes one of the most powerful natural anti-inflammatory signals the body has. Chronic psychological stress elevates cortisol and keeps the autonomic nervous system locked in a low-grade fight-or-flight state. What the science supports for reducing systemic inflammation and restoring autonomic balance. Omega-3 fatty acids from fatty fish, walnuts, or high-quality fish oil supplements have been shown in multiple trials to reduce CRP levels by an average of 35% over 12 weeks. A study in Nutrients found that adults over 60 who supplemented with 2 grams of EPA and DHA combined daily showed significant improvements in salivary gland function within 8 weeks. Polyphenol-rich foods, berries, dark leafy greens, extra virgin olive oil, green tea, directly suppress inflammatory cytokine production. The Mediterranean dietary pattern, which emphasizes these foods, has been linked in multiple large-scale studies to a 43% reduction in inflammatory markers over 2 years. Restorative sleep, 7 to 8 hours of continuous quality sleep, is when the lymphatic system clears inflammatory waste from the brain. Prioritizing sleep hygiene is not optional, it is a direct medical intervention. Daily moderate physical activity, even 30 minutes of walking, triggers the release of interleukin-10, a powerful anti-inflammatory compound produced naturally by your muscles. Stress reduction, through mindfulness, social connection, time in nature, or simply limiting media consumption, has measurable effects on autonomic nervous system balance and has been shown in clinical trials to improve parasympathetic function within 6 weeks. The Complete Action Plan. Starting tomorrow morning, drink 8 ounces of water before you do anything else, before coffee, before medication, before you check your phone. Start your day by rehydrating. This week, write down every medication you take, prescription and over-the-counter, including supplements. Research each one for dry mouth side effects. Bring that list to your next doctor visit with specific questions. This month, schedule a comprehensive blood panel that includes fasting glucose HbA1c, complete metabolic panel with creatinine and eGFR, CBC-CRP. If your doctor agrees, based on your symptoms, ANA panel and thyroid function tests every day. Add at least one anti-inflammatory food to your diet, a handful of walnuts, a cup of berries, an extra portion of leafy greens, a drizzle of extra virgin olive oil. Set your bedroom humidifier to 45 to 50% humidity. Avoid alcohol for at least 3 hours before sleep. Try to be in bed with lights out by a consistent time. Critical errors to avoid. Do not assume that drinking more water is the solution if your dry mouth persists. Water addresses the symptom, not the cause. Do not ignore a dry mouth that comes with other symptoms like fatigue, frequent urination, swollen joints, or blurred vision. That combination is a medical pattern, not a coincidence. Do not skip your annual blood panel because you feel fine. Kidney disease, diabetes, and autoimmune conditions can all progress silently for years before you feel them. Final message: empowerment, not fear. Waking up with a dry mouth is not something you have to accept. It is not just getting older, it is your body sending you a signal. And now, you have the knowledge to read it. Here is my challenge to you. For the next 30 days, implement at least 3 of the specific changes I have outlined today. Hydration discipline, medication review, anti-inflammatory nutrition. Better sleep. 1 walk a day. Track how you feel. Notice what changes. Your body has a remarkable capacity to heal when you stop ignoring its signals and start responding to them. Summary of the 7 causes. Mouth breathing and sleep apnea demand a proper evaluation, not dismissal. Chronic cellular dehydration goes far beyond drinking a glass of water. Medication side effects: over 500 common drugs suppress saliva production. Autoimmune conditions, like Sjogren's syndrome, which affects millions and goes undiagnosed for years. Blood sugar dysregulation and diabetes announces itself through morning dry mouth long before formal diagnosis. Kidney function decline whispers through dryness and metallic taste while silently progressing. Systemic inflammation, the root driver that connects your dry mouth to nearly every major chronic disease of aging. Every one of those causes is addressable. Every one of them is something you and your doctor can work on together. You are not broken. You are not simply old. You are someone whose body has been trying to communicate. And today, you finally have the tools to listen.